Hey guys, how are you? Happy quarantine. I don't know about you, but I'm kind of losing it in here. You know, it's just like driving me crazy. There's nothing to do.
Gonna ask you for number.
Then I want my side. Life for the girl, I'ma tell try come round so. Things that it never come back to me, dog, when it right.
So as you guys probably saw by the title, I had surgery on my jaw. That is why my face is so puffy right now. My whole mouth is kind of like reworked, I guess you could say. So I don't know if you can hear it, but I kind of have a lisp. And I can't even really say the word lisp. But yeah, I guess we're gonna start from the beginning. That would make sense, right? I got braces in 7th grade, and I'm now a senior in high school. So yeah, I've been rocking with these for a minute. My sophomore year? No. Yes. No. My junior year. Okay, yeah. My junior year, my orthodontist told me that this would be the time for me to actually get my surgery. So when I first got my braces, she let me know that, like, okay, your mouth, you're probably gonna need a surgery. And I was like, let's try everything we can first, because it was like, that's kind of a lot. My junior year is when I had to get in touch with like a surgeon. So she gave me a recommendation, and I live in New York. So the doctor that did my surgery is Dr. Elshiva Rosenfeld. She has 2 offices. One is in Manhattan and one is in Long Island. So at first I was going to the one in Manhattan because that's where my orthodontist is, but then I just went to the one in Long Island because it's closer to my house after a while. So I just want to start off by saying, if you're a person that's like really sensitive to things, there will be videos that I'm putting that might like be cringy or freak you out or scare you. Don't watch the rest of this video. I'm telling you right now, just don't, because it happened to me. Sometimes watching those videos kind of scares me and freaks me out. So I wouldn't suggest that you continue this video if you're that type of person. But if not, we can keep talking, you feel me? Okay, yeah, so the surgery that I had done was on my top and my bottom jaw. The top jaw is called a maxillary osteotomy. Maxillary osteotomy. Basically what she did is like she cut across my top jaw and shifted it forward because I had an underbite, and so like it could come over. And then she also cut my bottom jaw on like the sides and cut out some bone to push it back. Bottom jaw is called a mandibular osteotomy. Mandibular. I'm gonna say mandibular osteotomy. It might be mandibular. I'm gonna put it right there. And however you say it is however you say it. Okay, cool. My surgery was 6 hours long. There are no incisions like outside my mouth. All my incisions are inside my mouth. Sometimes, depending on what your surgery might be, they might have to make small incisions outside, but I didn't have that problem. This is where I went. The doctor that I underlined is the doctor that did my surgery. If you are having surgery and you do live in New York, I would absolutely recommend her. Like, first of all, I was scared out of my mind. So my first meeting with her, I had this list of questions on my phone, and it was so long. Oh my god. She comes in and she's talking to me and basically like asking my name, what I like to be called, all that stuff. And then she was like, so I see there that you have some questions. She basically answered every question that I had. She showed me a video of how it was going to be done. Every time I went back to her, I had questions and she always answered them for me. If you are having this surgery, I suggest that you really think about it, because if you're not the type of person that can push through, like when you're feeling down or something like that, or if it's hard for you, I wouldn't suggest it, because I'm a pretty tough person, but after a while it started to get to me too. The one thing that she had said to me when we sat down and had our last meeting before my surgery was not to look in the mirror the first few days. And of course, me being myself, I was like, please, it's not gonna bother me. I felt like I had to use the bathroom, so I get up to use the bathroom. And of course, you need help because you are under anesthesia. Like, you can't really feel your whole body. Even though it was just my face, my entire body felt weak. So my mom was like taking me to the bathroom, and the nurse was there and whatever. So I'm washing my hands. Why would they do this? Like, you need to have a separate area for the oral surgeries. Why is there a big mirror where I'm supposed to be washing my hands? I'm not supposed to look in my face, right? So of course I'm gonna look up in the mirror. Why would I not look up in the mirror? So I'm looking at my face and I'm like, yikes. And I'm washing my hands and I'm like, wow, girl, you might cute today. It didn't really bother me. Like, my mom was like, why are you looking in the mirror? That's the first thing she told you not to do. And I was like, first of all, I know my face was gonna be swollen, of course. But like, at first when I was in the hospital, it was fine. Like, I was just like, I expected this. Like, there was like redness around my lips over here. Like, it obviously went away, but it was like red and bruised. And that was the one thing that bothered me, because it's like, if you know me at all, you know I love my lips. Like, that's a favorite part of my body. If I'm doing makeup, like, I love my lip gloss and my Blistex and like my Vaseline. I like to keep my lips like nice. She told me and my mom at our pre-op appointment like everything to expect. She gave me like a folder of all the medications I would be on, and like what to buy, what not to buy, what to do, what not to do. So she told us to buy like a really big tub of Vaseline or Aquaphor. Well, not a really big one, but enough. So your girl went out and bought herself the gigantic thing of Aquaphor. Let me show you how much I've used since surgery. It's not like, it's enough, but I didn't need this much. Like I said, it had the folder with all the medications that I would be taking, and basically like a paper to explain what my surgery was. So they gave me this like little thing also. Now it only has like chapstick and my rubber bands, because I do wear rubber bands in my mouth just to keep my jaw structure together. But I took them out because of the video, and honestly, it's not the most flattering thing. Sometimes it kind of makes it harder to understand what I'm saying. So I will put them in after, but it basically came with a pack of rubber bands, some chapstick. And never was my grandmother using the blender after I just told her I was making a video. Grandma! I got 2 little toothbrushes to use. They're like baby toothbrushes. I got these like little tools, I guess. And like, if you can see, there's a little dip in the middle of it. This one's better. There's a little dip. What these are for is to help you put the rubber bands in, because in the beginning there's a lot of swelling, so you can't necessarily like open your mouth as big as I can now. But these little things are actually really helpful.
City's gonna break my heart.
Hey kiddos. So it is currently the It is currently the night before surgery, and my hair was in a low pony. Then I actually realized that maybe I should braid it just so I can have it back and like lessen my face. I have packed a bag actually for the hospital, just like pajamas and comfortable clothes, because I will be spending the night there. Actually, they also said I'm not allowed to eat anything starting from 11 o'clock, because apparently anesthesia makes some people nauseous. After coming out of surgery, I will throw up due to the anesthesia. My surgery is at 7 a.m., but I have to be there an hour ahead, so I will be there at 6 a.m. Okay guys, so I gave myself 2 braids. They don't have to be perfect, I just need my hair out of my face. So I had to change for surgery. The nurse came in, she took my vital signs and everything. But yeah, so it's about 7:10, I think. I'm not actually sure. And around 7:30 I'm gonna go into the OR. And when I come back, I'm gonna be like groggy and all of that. And my face is gonna be wrapped. And like I'm really scared, but also like I'm kind of excited for like when it's all done. It'll be worth it. But yeah, ST day. I sat by like a bed area. It was like a bunch of beds and then the nursing station, I guess you can call it. And like basically they just came to me a few times, like a few people. There were so many people who came to me that day. There was the anesthesiologist, there was the anesthesiologist resident, and then there was my nurse, the OR nurse, and then there was the resident who was working on my surgeon's case, and then there was another resident who was working on my surgeon's case, and then there was my surgeon, and I just know there were a lot of people. So many events. The only person that day that I actually like really remember their name besides my surgeon is the OR anesthesiologist resident. So that morning, Sarah came and she talked to me about like what my anesthesiologist would be doing, and there were so many people that came to me and asked me a bunch of questions, but I think that's just the safety purposes, like with the hospital. And so a lot of people came to me and asked me like basically all the questions on my band, because I guess they wanted to make sure like they're not giving the wrong person this surgery. Every time somebody would come and ask me something, before they asked me, they look at my band and they ask me my name, my date of birth, if I know what surgery I'm having, and they would make me explain it to them. And I was like, okay, so this is a lot. So yeah, so she came to me and she asked me like my name, my date of birth, and all of that, and then she basically explained to me like what her job is. And she asked me if I had any questions or anything. But here's the kicker. I was good until they came to me. I was like trying to calm myself down because my nerves started kicking in. So I started listening to music and I was like, all right, positive thinking. Like, this is actually something you want to do. Don't let the fear make you not do it. So I was sitting there and I'm listening to my music and I'm like, whoozah! Like, I'm trying to stay calm in all of this and I cannot, like, and my mom's trying to talk to me and I'm like, Mom, I love you, but please stop talking, it's not helping me. So I was like, can we not talk? So I'm sitting there and I'm trying to breathe and I'm like, hoo. So when they come to get me, I don't know why, I expected them to like pull my bed out. Like, you know, like I watch Grey's Anatomy, they always take you on your bed. The area that we are at, it's literally right next door to the OR. So like you're there and you go through 2 doors. There's a big sign that says stop, like you can't go through here if you're not a doctor or a patient getting surgery. I'm going through the 2 doors and I absolutely like lose it. Like I cannot do this. Like, why did I do this to myself? So I'm walking through and the nurse took me and I'm walking through and I experienced like I saw the big stop sign and I was so scared. And like I'm walking and she's asking me if I'm okay and I'm like, like, and then I actually see the OR and I'm like panicking. You ever watch a movie and like they show like from the person's perspective, like their eyes just zoom in on like every single bad thing? Like every action movie has that. For me, I walked in the OR and the first thing I see is like that big tray with all the blades and scalpels and scissors and all of that, and I was like, oh my gosh. And there was like this big thing, this big light thing above the bed, and on the bed looks so tiny. It's not even like a real bed, it's like a little board, and it's not necessarily uncomfortable, but it was weird. So they told me to lay on the bed, so I had to get on a step stool and I sat on the bed, and like there were so many people working around me and like my heart was beating out of my chest. Like as I was walking there, like it started getting worse for me. The nurse who walked me to the OR, like she was holding my hand. They told me to lay down and there was like a like, you know, the airplane pillows, it was kind of like that but a little different. It was for your head, so they told me to put my head there. So I'm laying there on the bed and Sarah, the anesthesiologist, she tells me to like put out my hand. So it's like a bed, but it also has like, it's kind of like, I don't want to say a cross, but it's kind of like a cross because there's like two arm things to stretch your hands across. So they tell me to put my hands down and I'm so hesitant to do it. Like, I got so scared. I don't know what I thought was gonna happen. I put my arm out. I put out one arm. I put out one arm, and then I was like scared to put out the other one because that's the side the anesthesiologist was on, and I was like, okay, he's about to shoot me up. And I put out this arm, and they wrapped the blood pressure thing around me, and then like I can see on the the screen like my blood pressure. And I put my arm out, and on my legs, I put my legs out, and they covered me with this like blanket, and they covered both my legs in some type of like, I don't know, but it also had Velcro, so they covered my two legs. And after a while, it felt like it was sucking on my legs and then releasing air, and I like jumped because I was like, what is that? That is scary. I don't like that. So then she told me that I had to put my arm out, and like all these people that were in there I hadn't met until today. The only person that I actually knew was my surgeon, and I saw her one time, and then after that she had to go back and like do all the things that she had to do, I guess, to prepare for my surgery. So I was there and I was like, can I please see her before you put me under? Because like I didn't want to say it to them and be like, I don't know you guys, but I just met you. It was so scary for me because, as I said, like I've known my surgeon for a year because it does take a lot of time to prepare for this surgery. So she ended up holding my hand, the OR nurse, because she could tell that I was scared because I did start crying. Like I was laying flat and my tears were just going like down, and I put out my other hands and they put in the IV. And like for me, I'm not really afraid of needles, but I like wait for that pinch. So I had my eyes closed and I was waiting for the pinch, and it wasn't bad. And then I was like asking her, I was like, where's Dr. Rosenfield? And she was like, she's getting ready. I was like, can we please wait for her before you put me under? She was like, usually they put me under before, like, so when Dr. Rosenfield gets in there, she can just start or whatever, and they can all be like scrubbed in, I guess. It was scary because I didn't know anybody in there, and I was like hoping to see her face. Like, I don't know, sometimes you just need to see a familiar face. So I was there, and like he put the mask on my face, like the actual anesthesiologist. He put the mask on my face and he was telling me to breathe it in, and I didn't want to because, first of all, you already put the anesthesia in me, and like I know what happens from here. You're putting a mask on my face, you want to get oxygen in my body, like this is the time I'm gonna fall asleep. First of all, I'm like, I want to see Dr. Rosenfield right now. Like, I'm already scared. I really don't know any of you. This nurse is the only person that I actually feel comfortable right now because she's holding my hand and she's like telling me it's gonna be okay, and I'm crying, and he's covering my face with this oxygen mask, and I'm trying to like not breathe it in, and he like pushes it a little closer on my face, and I'm trying to talk and say like, I need to see Dr. Rosenfield, like this is not gonna work. Long story short, I fell asleep, and that was like low-key traumatic for me because I was like, you're pushing this on my face, like I really do not want to breathe this in, and I'm already scared. I haven't seen her face yet. I'm like looking at, there's two doors, and I'm looking at the two doors, and I'm like, yo, why is she not here yet? Anyway, so that was a lot.
Can you see I do bend? Can you get it? Can you see I get it? Bend? Can you get it? Can you see I can bend? Can you get it? Can you see
I guess they moved me into my room because when I woke up and I was in it was the night. I woke up and I was in my room. They gave me my medication and big syringes, and it like just squirted in my mouth, and it's hard to swallow. She did say to me, try to take the medication that they give you as good as you can, because if you're not taking the medication, then obviously we have to keep you in the hospital longer. Nobody wants to stay in the hospital longer. My nurse, I think her name was Marianne, she was the bestest because I didn't have a private room. I had a room with somebody else, and let's just say that somebody else was like not the best person in the world. She was so nosy, she was so loud, and like every time I tried to sleep, I'd like wake up because she's like some type of altercation. Like either she was cursing her mom out or she was screaming at her mom on the phone, and I was like, this is so rude and dramatic. So my mom is jokes. So my mom, she had my little brother at this hospital. If you guys know anything about North Shore LIJ, you know that they're all about their reputation. They're all about their customer service. I love them. So, my mom, she made a comment to the nurse and she goes, if I had known it was going to be like this after she had surgery, I would have took her somewhere else. And I was like, oh. I heard about it when I got back home though. I was actually asleep. I was like, oh my gosh. All I know is that after I took my medication, I went back to sleep. When I woke up, the nurse came in the room and she told the girl she had 5 minutes to pack her things. I was like, oh, what's the tea? The next morning, my surgeon and her 2 residents came in to check up on me, and I took all the medications I was supposed to take. I did the mouthwash, rinse thing, and the reason that I say make sure you take all the medications and stuff because you don't want to stay in the hospital. It's not like when you go home, she tells you, like, if she told my mom at least, if I'm sleeping, don't wake me up for my medication because sleep is hard to get because of the congestion. Yeah, no, the nurses, like, hospital protocol, they have to wake you up. So I like my sleep. When I tell you I woke up at like 2, I woke up at like 4, I woke up so many times, and already I was waking up because I couldn't sleep. And then I woke up when, like, as you guys will see in the videos, there's like a big ice bag on your face. Sometimes it leaks, so you wake up because you're wet, and I'm like, okay, I'm gonna take this off now, and press the nurse button, and I'm like, it's dripping, and she would have to change it for me. So my surgeon came in the morning, and she came with her 2 residents, and she said that I was doing well, and they talked to the nurse, and the nurse said that, like, I took all the medications that I had to take, and she basically cleared me to go home.
So you say you wanna get away. We don't need a plane. I could be your escape. Take you to a place where there's no time, no space. I could be your private island on a different planet. Anything could happen. Listen to the waves.
So my voice is a little messed up because of my congestion and just like my overall sinuses, as well as that, like, my mouth has just been realigned and I have to get used to it, and I have rubber bands in, so my mouth is kind of like shut right now. I just had my 1-week appointment post-op, and she said everything was fine and that I'm taking good care of it, like, hygiene wise. The problem is I haven't slept this whole week, and it's been like really hard for me to like sit down and make a video because of, like, there's so much raw emotion. Like, I wake up in pain and I cry. And I cry because I can't sleep, and sometimes my nostrils are clogged and I can only breathe through my mouth. So when I try to eat something, it's like if I don't swallow like this, I feel like I'm suffocating because it's just sitting in there and it's clogging my airway, you know? So it's been an emotional roller coaster for my first week, and I'm happy that things are going well, but my swelling has gone down compared to the first few days, but also putting ice on my face, it's like I can't keep it on for too long because then it starts to feel like pins and needles, and it like burns, if that makes any sense. Like, to me, the way it feels, the pins and needles, it burns. and it gives me a headache, and it's like to have my face hurt and my head hurt and my mouth hurt, it's too much. And I really cannot. I kid you not, I don't understand it. 2 days after my first week post-op appointment, I could sleep. It's like heaven just opened up and looked upon me and said, look, you need it. I slept like a baby, and I woke up at like 9 a.m. and I was like, oh yes, like yes, this is what I have been waiting for 9 days. 9. Now here's the thing. What they forget to tell you after jaw surgery is that sometimes if you yawn, there's gonna be a crack on the side. So me now, I'm in the car driving with my mom. This was pre-quarantine. I yawned and it said, like, I heard it in my face, and it was like, and I was like I was afraid to move my mouth. I was like, okay, so never did I go through this whole process just to break it by yawning. Like, what is happening? Titanium screws? Really? Are you not working? Like, what is wrong with me? So I was like, Mom, something just cracked in my mouth. Did I break it? So, I started moving my mouth around, like, side to side. Like, I was, like, trying to, like, figure out if it's broken. But I feel like it would have hurt more. So I was like, all right, I didn't break it. I think I'm good. So that 1 month appointment, I went, and I was like, the cracking sound in my mouth? What is that? And he was like, yeah, no, it's fine. I was like, I panicked for no reason. And that has been my update. Thank you for coming to my TED Talk. Yeah, so I will see you guys again because quarantine. Comment down below how your quarantine experience has been, because personally, I'm so bored, and this homeschool thing that I have going here is just not working for me. Thank you guys for watching. Like, share, comment, and subscribe. This video is now 45 minutes long. That is crazy.
21 minutes until I gotta go, so I told that girl I'm gonna slaughter it.